Do we have Deborah from Sky?
Yes.
Please go ahead.
Can you hear me?
Yes, Deborah, please go ahead.
Thank you. Thank you so much for the opportunity. Oh, hold on a second. Director General, obviously you've been asked quite significantly about the comments made by President Trump yesterday, but could you just address the specific concern? It's not just been raised by President Trump, but also by officials privately in the West, including in the UK, a concern that maybe you're a bit too close to China. China supported your appointment when you ran to be Director General, and that perhaps coloured your approach, coloured your view when you were initially in the early stages responding to the crisis in Wuhan, and perhaps you weren't questioning enough of the assurances being given by the Chinese authorities and their figures, their statistics. The fact that their statistics, in terms even now of the death rate, are so different to, for example, in the United States. How do you respond to that, please?
Yeah, thank you. Thank you so much. First of all, I have a recommendation to the media. When I say we have to quarantine politicizing, I have to also recognize the role of the media in some countries, adding fuel to the fire and politicizing too. Please mobilize the whole world to fight against a common enemy, an invisible enemy. That's number one. And coming to the question you said, we're close to every nation. We're colorblind. We're, what do you call it, wealth blind. We don't see. For us, rich and poor is the same. For us, weak and strong is the same. For us, small and big is the same. For us, people who are in the south or in the north, east or west are the same. I will tell you a story. When I appointed my chief nursing officer of the whole wide world, I picked her from a country called Cook Island. Then people started criticizing me. And I said, what happened? What is this Cook Island? Is it Thomas Cook, the company, or what Cook? On one hand, it could be arrogance. On the other hand, it could be ignorance. Ignorance could be okay, you can correct it. But I was so sad when I saw arrogance in it. The arrogance part is people didn't want to have a chief nursing officer of the whole wide world from a small country like Cook Island, which is only 10,000, a chief nursing officer. But my belief is talent is universal. Opportunity is not. You can find the most talented person from a country with a population of 11,000 like Cook Island, or 10,000. So we work with Cook Island, 10,000 population. We work with China, 1.4 billion population. We were criticized for the 10,000. Is it because Cook Island influenced us? Using what? And China, using what? We see everybody equally. We want to see everybody equally. That's what we want, that's what we do. Because we belong to all member states equally. We don't want to create differences between our member states. We would like to see all of them through a very similar principle, identical. I hope the Cook Island story will tell you loads loads and loads. So we respect every nation. We work with every nation. We try to understand the problems with every nation. We try to help them understand the root cause of the challenges and help them. The most important thing is that. And we see the whole world equally. And I assure you of that. And then I said, we will do assessments. If there is any wrongdoing, you will see it. The time will come when all players check what they have done well and what they have screwed. Not only WHO, all players. And then build on our strengths and improve our weaknesses, focusing on the issues, and making this world a better world. So the most important message now is, let's fight hard. I said it many times. Let's fight like hell to suppress and control this virus. It's dangerous. We need unity. And again, I remind, including the media, in even developed countries, please advocate for unity and help to bring this virus to its knees. It's dangerous. Let's not continue to play with fire. It's a dangerous fire like bushfire. It jumps, it grows exponentially. Many behaviors that is unknown to this virus. Still, we will have more surprises. High-income countries were surprised. And we're worried about Africa now. Our continent, my continent. It behaves in a way that sometimes we don't know because it's a new virus. So let's bring our energy together and fight it, fight hard. And with that unity, with unity and human spirit, it can be defeated. Otherwise, with the way we're doing now, I think we will regret it. Thank you.
Okay, we will try to have one more, obviously, unless Director General tells otherwise. We will go to our friend Bianca Rotier from Global. Bianca, can you hear us?
Hi, Tarek. Yes. Can you hear me?
Yes, Bianca, please go ahead.
Yes, I would like to know from Dr. Tedros, what would be the consequence in the case the US government puts contributions on hold, as he promised?
Sorry.
The question is, what would be the consequences if the funding would stop?
I think I have answered that question. Let's go above whatever specific issues you're raising. I'm asking for a bigger agenda. Let's go to a higher level. With unity, with solidarity at national level, global level, resources will not be a problem. We're asking to quarantine politicizing. We're asking for a genuine solidarity. So what's resource? It will come from all, including the US. It will. By the way, I would like to use this opportunity to thank the US for its generous support so far. I have known the US generosity when I was a minister in Ethiopia, health minister. when the HIV pandemic was ravaging the world, and especially Africa, when many were dying, schools closing, families losing hope. As a result, nations losing hope. And I remember then the intervention from the US, from President Bush, when he started PEPFAR, that saved millions of lives, brought hope to families, brought hope to nations, brought hope to the world. Not only PEPFAR, but a third of Global Fund contribution is from the US. And that goes into HIV too. And in the US, supporting global health has been a bipartisan position. What I believe is it will continue that way, because I have seen it at country level working well, and global level also working well. So that's what I believe. US will continue to contribute its share. Other countries will do the same. And my experience has always been a bipartisan position. And that's what I expect now. But I use this opportunity to thank and appreciate the people and government of the US for their generous support. And we're very grateful for that, and the world is grateful. And the world is getting smaller and smaller. We need more solidarity and unity more than ever before. It has come, the need for solidarity has come even more important than ever before. Anything that starts in one place affects the whole world. We cannot live in our nation-state boundaries. We can't. Globalization is a must. Something we should accept, we have accepted, and live with. But that means interdependence and helping each other. And that's what I see in the US, what I hope and believe also will continue to be the case. I thank you.
Thank you, Director General. Dr. Tedros, you have a call, but obviously it's up to you.
That was the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, and answering serious claims laid at his door by none other than the President of the United States that he's too close to China. Remember, there is concern not only in the US, but across countries that China may have hidden the extent of COVID-19, of the spread in the beginning, questions about the numbers even now. And he's not answering a lot of those questions directly, rather calling for unity, calling for COVID-19 politics to be quarantined. He did seem to answer one question directly: is he too close to China? And he said that the WHO is close to all nations, so rejecting any sort of favoritism towards China, even addressing the huge issue of the US possibly withdrawing funding from the WHO, saying he doesn't believe that'll happen. There's always been bipartisan agreement that there should be contributions to the WHO. Now, Africa is also part of this. This has become a political issue. It's become an issue across the world because the WHO is spearheading the fight against COVID-19. What happens if there's a split, if their moral integrity, as one journalist said, is questioned? And our own president also entering that fray. So let's bring up a tweet for you now, just to see what Cyril Ramaphosa has tweeted, saying that the most potent weapon against COVID-19 and its devastating health, social and economic impact is international cooperation and solidarity, which is why the exceptional leadership displayed daily by WHO and Dr. Tedros during an unprecedented global public health crisis is incalculable. So the president of South Africa also entering this fray and saying that South Africa believes in the WHO, even and there an endorsement of the leadership of Dr. Tedros himself, who is under attack in the United States. Very interesting developments, and that really overshadowed anything about the numbers about the spread of COVID-19 during today's WHO